beautiful words and experiences and is felt by all and for all and for everyone. I'd like to welcome Olivier, Mr. Olivier VÉRAN, Minister of Solidarities and Health. Well, I'm delighted to be with you here this morning. I used to take part in this in-person meeting, very important meeting on health management and health analysis and management. So I have a few questions for you. You've been instrumental in really trying to plan for things that at times can't be planned. And so as a result of going beyond quarrels and focusing on what's most important. Can you tell us a bit more about transformation within this period of what needs to be really driving forces to improve the systems? So indeed, considering the immense project within the framework of this negotiations on health management, I think hospitals, clinics, community health care is really clearly has really been focusing on addressing COVID-19, being responsive, caring, most importantly. All the local quarrels, disputes have been put to the side with a key priority being taking care of those impacted by COVID-19. Finally, territories beyond communities have put their energies together between community practices, healthcare centers, hospitals, and the Ségur, this convention, this on thinking and rethinking healthcare management. I've really put aside anything that was not necessary. We authorized remote consultations by nurses. We really wanted to leverage the system and to make everything optimal. My mother, who got consultations remotely and following hip transplants. And it was a request. It was smothered by constraints, and I wanted to unleash those restrictions, those obstacles along the way. So that's the first principles. Secondly, governance and medicalization of elderly people's healthcare places of residence. This is a key stake here in terms of healthcare continuity. I've visited many regions in France during the crisis, and I've seen that elected politicians, healthcare professionals, have put all their energies together. So these are, 3 examples, 3 measures, and plus all the 1.2 billion in state aid, being put to medical and healthcare services. So we want to give a new purpose to all the healthcare stakeholders. When it comes to the governance of hospitals, nurses, and the whole systems, we've talked about simplification. So what about all these agencies, healthcare agencies, healthcare organizations? Acronyms are very many and reflect this complexity, these layers. And every crisis, like every crisis, has led to the creation of a new entity. I think we have 15 different layers here at this point in time in France. This is a very complicated system, indeed, and very difficult to have a clear vision. And we need to adapt to communities, we need to adapt to territories, regions. And when we talk about hospitals, at times there are territorial rules that are too cumbersome. And, yesterday, and I attended a hearing at the Senate, and we precisely discussed these matters. Concentration at times is not necessarily the best of solutions. And we need to be as flexible as possible in the regions. And we need to maintain hospitals where it makes sense. Or maybe making things less, let's say, cumbersome compared to what they are here. And I can, as an example, we need to strengthen the regional health agencies' powers and servicing the local communities. Do you think that the problem is, when it comes to hospitals, that the big problem is management? We manage more than we make hospitals more dynamic. And especially for those future service or healthcare unit managers or healthcare clusters. What can we do? So I studied medical. I went to medical studies for 6 years. I can say that there was not a common trunk, not a common section with physiotherapists. I'm not directly answering your questions, but I think training is essential. We cannot manage teams if you haven't learned how to do it, if you haven't learned how to do the job. You might be a major lecturer, key physician, but you need those soft skills as well. You need to be able to identify those people with managerial skills. And indeed, you need to go get those people with those skills. They might not be, they might not have a medical background, but they might have these managerial skills. So we need to rethink the training curriculum there. This is a kind of aspiration we tend to, but it's still a long way to go. And conflict management, as an example, is a major aspect of those skill sets. So, maybe physicians, they prescribe, but they don't have vision of, field operations in terms of beyond their kind of usual scope. If you're a healthcare assistant, if you don't have any local nursing network, as an example, for instance, for those when people in a elderly home is suffering, we would give them drugs to treat to address their pain. Even this was not allowed. We were not within the kind of normal framework. So we need to address that as well. What about the relevance of medical acts, medical procedures? And are you going to put in place a voluntary policy to enhance the relevance and the quality of medical practices? As there are 20% of medical acts that are deemed not useful, i.e. 14 million medical procedures in France. That's such a waste. Well, I want to develop peer-to-peer evaluations. I want to develop an approach referred to as the collective commitment. And this is about involving medical teams, paramedical teams, and that can be to the tune of field support with due to quality, relevance, curriculum, and this involves the whole team. When all the teams is engaged, they get a bonus of 100 euros net per month, just to re-evaluate, just to enhance the significance of the role they play. So, indeed, in terms of FTEs, healthcare services is very costly, but I want for us to develop quality policies, the positions. I want to see the creation of in hospitals. I want for this to be operations, not administrative. So it means that with the means, the resources we have, we want to fully engage in this policy of evaluations. You know, evaluations is not a sanction. It's not something we should be fearful of. I want to move faster when it comes to the healthcare offering. So every time proposals, I want for these to be relevant and quality-driven. And with this method, we will make it happen. We will succeed. We need to develop tools, but we really need to fully engage in that. Right, okay. What about prevention? Prevention is undeniably an issue when it comes to healthcare system from the organizational plan and funding plan. When do you want to promote prevention with results coming late, which is a different kind of a schedule from political action and political mandates? We come to a period now where people are fed up. This is like social distancing, hygiene etiquette. You know, we need to, you know, people are starting to be fed up with this. Sometimes this hygienist-driven policies, you know, annoy people, you know, when we increase tax on sodas, alcohol, when we ban smoking in certain areas. We need to be capable to have a proactive prevention policies, and because everybody is talking about prevention, when I look at the set of measures that's put forward by experts, you know, beyond behavioral tax, when I take away everything that can be considered as intrusive in people's life, there might not be that many proposals there. I'd have priority of prevention. March 2018, this started there. It continues to be articulated in territories, in the regions, but obviously I am very much in favor of prevention. So I put in a lot of those values as transposed in laws I promoted. So the Nutri-Score being published, publicity, advertising limits for junk food, and so every one of these points can be a source of dispute and can be a source of limitation. So that's why within the framework of the latest health think tank, and that has, you know, referred to as the Ségur de la Santé, I want to base our discussions on a group of people who know what things are like out there, who you know, combine this health, environmental, economic, social, sociological, even philosophical, who bring together this wide-ranging array of approaches with a view to coming up with proposals that can benefit the entire society, so that in the spring we're like, okay, we're at the crossroads. If we want to have a transformation, a real transformation, this is what we are proposing. Now, are you ready as a society in France, and are we ready to move forward? This is what I believe in. Just 10 days ago, Ursula von der Leyen launched an advocacy for a Europe of health, notably the idea of the European Union that could supersede the current prerogatives of member countries. This is a profound change toward integration to a more federal echelon, federal scale. Now, what is your take on that? Some 10 years ago, I wrote an article on from Les Echos, where I noted that health is a local community issue. It is a local issue, and Europe can play a role in interfering in a positive manner in people's life. And this is a way of getting closer to the community, the individual, and the citizens. I think we were kind of equipped to address pandemics, but the first few weeks of into the pandemic showed how difficult it was in Europe. When it comes to addressing these, we worked a lot with Jens Spahn and work a lot with Roberto, Salvador, the Spanish counterparts. We call each other, we send each other WhatsApp, we have WhatsApp groups here, and it works really well. And we try to have a consistent, smart, and consistent approach. But it is difficult. It's challenging because we're not equipped fundamentally to address these. I think the Europe of health must have a number of purposes.
Quand on parle de production de médicaments,
we talk about medication, drug productions, as well as medical devices, and we need to think European to counter the risk of being dependent on countries beyond Europe. We need to have a better coordination with more European funds when it comes to funding research, and fundamentally I believe that we'll never be able to harmonize here, but we need to tend to common values and of social protections, because various models of social protections penalize, hinder Europe at times, and inequalities when it comes to public health. Why can I not mainstream Nutri-Score? And we would like, because there would be a significant risk of European proceedings launched by Portugal or Italy, where Germany, Belgium, the Netherlands have switched to this system and move forward. So we want to set public health objectives which have the same currency. We have an additional 10 years, plus or minus 10 years of life expectancy more or less in Europe, and we have a child mortality ranging from a factor of 1 to 5 in Europe. So Europe, for this to make sense, has to be Europe of health. So really, I'm really in favor of a better integration of European health policies. So maybe not, how about a group of 1, 4, maybe not all 27 countries, but maybe embarking a group of 4 or 5 countries in that strive? Well, there's the 4 of us. We were called a divas, so with Italy, notably, and Germany. Right, okay, we need to make sure that when an efficient vaccine against COVID-19, well, we need to make sure that this will benefit all of the European countries, as we're going to be working with the most advanced labs, and we're going to see AstraZeneca in the UK, research developed by Oxford University. They're the first ones to enter phase 3 clinical trials. And we'd like to pre-order 300 million doses for the whole of Europe, irrespective of countries, who have contractual clauses. So reading contracts, access to data, security clauses, and we cut a deal with them. And then we went to see the European Commission, who said, okay, this is what we've done. What we're proposing is that with 27 member states, you can get this. And the European Commission said, well, okay, this is what we can do. They got the contracts, and for pre-ordering and ordering when the vaccine is ready. So we have European experts, and they will visit every one of the labs working on the vaccines, and will apply this system of pre-ordering. And so, indeed, this is a first step forward. Digital economy now. How can we guarantee national sovereignty of a health recovery plans? Isn't it in France businesses capable to respond to public orders so as not to remain dependent on the US? I think we do have businesses that can not only assert national sovereignty, but can develop these sovereignty even further in the field of digital technologies. I'm going to give you an example here. Stop COVID application. We worked with Germany, the Netherlands, and then when they said at some point it's too complicated, we're going to be using Google and Apple services, the GAFAs. No, and we said no. No. Given the political sensitivity of subjects, this is too. No, we don't want to call upon services of GAFAs, and we want to develop our own software. And it took us 3 weeks, and people are now using the software, and we've really developed a digital architecture along the way as well as part of the health recovery plan. And I wanted to really strengthen the digital policy on hardware and software, because we need to give hardware equipment with efficient hardware, and on software. The byword is the interoperability of information systems as opposed to dispersing these systems. Everything has to be interoperable. We need to develop smart software to help us. SunSetup is the software we use to enter test, and Setup was developed within 3 weeks. And it's linked to Santé Publique France, the regional health agencies, central health system, and so we need to move forward, definitely. And right, and the final question, what is your take on a possible transfer of responsibilities to the regions in terms of healthcare regulations? This is really a big issue there. Are you talking about regional councils or regional health agencies? No, this is about devolving responsibilities, including finances, funding to the regions. Well, I'm for more devolution as opposed to decentralization. So we went through the crisis, and I think the result proved me right. And from territorial and regional health agencies, I've visited at least 30 different departments since the start of the crisis, and everybody except for one person said, well, thankfully, the regional health organizations were there, and everywhere else, things went well, thanks to the regional health agencies, the ARS network. So this really is about supporting the system, strengthening regional powers. So when it comes to going beyond that, I think we need to take or consider the fact that countries, neighboring countries, with regional risk management, I don't think this is the right choice. This has to be centralized. It means that you entrust the central powers, to regional authorities. No. Who ordered masks? Who created the connections between hospitals, branches, and elderly home units? Who installs remote health remote consultations, teleconsultations. We'll have a system around centralizations. The players are quality players. I want to strengthen those existing players. And I want to introduce something that's radically new, allowing local authorities to participate in roundtables and discussions on funding. We're creating a national investment and funding unit, and all the elected members and regions will take part in this. Today they can't do it if I want to invest 1 or 2 million in new projects, because I think it's relevant to say we will say welcome going forward. So this means that regional health agencies could have more funding than today. We don't fund these regional health agencies. The local authorities will take part in funding, and they will have a say in the decisions. So presidents of regions, the départements, the metropolitan regions must sit in those, around those tables. So once again, we will rest upon our tools. Perfect. Thank you very much, dear Minister, and I hope you see you again very soon, indeed.
Merci pour le message de soutien.
Thank you very much for your message of support.